get to the bottom of the hour. Right now, though, we are so happy to have during this Heart Month with us this morning, Sara George from IRMC, a nurse who is specifically tasked with helping folks with heart conditions. It is Heart Month, and our visit this morning presented by Marcus and Mack, voted best law firm, best personal injury lawyer 3 years in a row, and the best of Indiana County contests. Visit them online at marcusandmack.com. Sara, anytime we talk about heart attack and heart conditions, we also need to talk about stroke too, don't we?
Yes, they tie in very well together.
Yeah, they're a big part of the whole mix, and it all starts right there in the middle of your chest.
Yes,
heart attack and heart pains, the signs leading up to it. We'll get into all of that this morning. Actually, IRMC has a chest pain center.
Yes, we do. We are an accredited chest pain center. We also have a PCI program, which essentially that means, Todd, that we are following the American Heart Association's best practices and guidelines across our whole continuum of care, from pre-hospital care to discharge to, even if you need cardiac rehab.
Now, is the chest pain center centrally located in one area?
It is not. It encompasses the entire hospital.
Mm-hmm.
And another thing that means is every single employee in IRMC is trained on common signs and symptoms of a heart attack and what to do if they see someone having a heart attack.
That's a pretty important thing, isn't it?
Yes.
And it's a tremendous undertaking to get
Yes.
people to fall into that training and be able and always on the alert.
Yes, and very important for everyone to know those signs, obviously.
Yeah. All right. So let's talk about some of those signs that you might be having a heart event.
So, obviously, the number one will be chest pain, chest discomfort. You might be having tightness in your chest, fullness. The pain might radiate into your jaw, your shoulder, your arm, maybe even your upper back. Mm-hmm. Some people experience a little bit of different symptoms, and those people might be women. So they might be having epigastric pain, upper belly pain, nausea and vomiting, and sometimes even shortness of breath.
Now, some of those things you named, we would never really, that wouldn't be our first choice. Let's put it that way, to say, okay, that's a sign of a heart problem right now.
Right.
We might say, I'll take a Tums for that, if we shouldn't.
Yes. So we see a lot of people who try the Tums route first, make sure that it's not acid reflux, and then they come to us. So just knowing those signs and being familiar with those to get to us sooner.
Yeah. There are different signs that women might commonly experience more so than men, and maybe vice versa too.
Yes. So women are often put it off as something else. And that's why it's typically missed, but they sometimes are complaining of flu-like symptoms, maybe feeling more tired than usual, maybe having some upper back pain, shortness of breath.
Yeah. Sometimes those signs come on so gradually that we push them off to another day.
Yes.
What should we do when we first experience symptoms that we might be able to relate to a heart problem?
So you should definitely obviously be calling 911 immediately. To minutes matter when it's your heart. The other thing is, obviously, if those symptoms don't go away, then you should know that it's something more serious. If they go away and come back, that's another big indicator that it might be your heart. So we urge you to call 911 immediately. Our pre-hospital team is trained, obviously, with how to care for you as soon as they get to you.
Yeah.
And that's really important.
You call 911, that ambulance shows up at your house. It's probably pretty important for us to know that those folks who are with the crew that comes to your house, they're in constant contact with the ER. Are they
Yes,
not?
they are. So if you are complaining of chest pain and EMS providers get to you, they are going to most likely be doing a 12-lead EKG, which is just a picture of your heart rate and rhythm. They have the capability to automatically send that to us. We can view it while you're probably still in your house. They also can talk to us, tell us if they think that it looks like that you're having a heart attack, and we can alert the entire team, the heart attack team, to get there before you're even at the hospital.
Some people might show up at the ER, not by ambulance, but just by private vehicle. They pull in, they walk in, they say, I'm having some chest pains. What happens from that point?
From that point, if you are complaining of chest pains, we are going to get that EKG. We are going to give that to the physician for them to interpret to see if there's any signs of a heart attack on that EKG. If there are not, we're going to do other things. We're going to do blood work, look at your cardiac biomarkers to see if maybe you had a heart attack or some symptoms earlier on before you even got there, monitor you, and maybe even admit you to the hospital for some further workup, stress test, echocardiogram if you would need to.
Yeah. Of course, from the ER, you might be headed up to the cath lab.
Yes, we do have one cardiac cath lab currently, staffed Monday through Friday, daylight, but we always have an on-call team 24/7 to take care of you. And if you are having a heart attack, we have that capability of taking you up to the cath lab.
Yeah, yeah. From that point, it's probably, for people who aren't initiated in this sort of thing, because people having a heart attack, odds are it's the first time they've experienced something like that. It's an amazing thing to watch that team as they swing into action.
Yes, everything happens very fastly. I always am reminding the patient we are going to do a lot of things to you all at once and very fastly, but time is heart muscle, and we try to get you up there as fast as we can and get that intervention as fast as we can.
All right, now you just said something there. Time is heart muscle. What does that mean?
So the longer, that we let those symptoms go and let that blockage go, the possibility of that taking longer for your muscle to heal.
Mm-hmm. Yeah, and you can measure the heart damage that has been done by whatever that heart attack is, can't you?
Yes, we can.
Yeah.
There's also a standard of care that we try to get you up there and get intervention in less than 90 minutes. That's a national guideline, national goal that we try.
Yeah. When we think about interventional cardiology and what IRMC is able to do, it really is a teamwork approach, and not just within the walls of IRMC. You have a great relationship with Butler, and
Yes.
and that's where everything just comes together. You bring all of those resources together to get the best outcome.
Yes, we do. A lot of our interventionists are also with the Butler cardiology team, and then the continuation of care if you would need further intervention than just the cardiac cath. So if you might need open heart surgery, those physicians would then let you go to Butler Hospital.
So we have been talking about what to do if you're experiencing chest pains and if you do have a heart attack. But then after the initial emergency is taken care of and you're, quote, all fixed up, there's the post-action, which involves cardiac rehab. But there's also something that actually before all of that happens that we might be able to do to help ourselves to avoid having a heart attack.
Yes.
And there are lifestyle choices and probably, well, I'm sure there are, steps that we should take as we get a little bit older in life or if we have a family history of heart concerns that we should be doing in terms of visiting doctors and getting annual checkups and screenings and all of those things, yes?
Yes, you should definitely be following with a primary care physician, and they can refer you to a cardiologist for workup if you need that. Also, they would be looking at your blood pressure, your cholesterol, all of those things that you might not be able to help, but then you can also have things that you can do at home, eat healthy, exercise daily, go on walks, and just really watch what you're doing, live a healthy lifestyle.
All of those things. There is actually an event coming up, or the Pop Pilates event.
Yes, tonight actually is
It's
our Pop
tonight.
Pilates, and it's actually fully booked. Very exciting. One of our electrophysiologists, Dr. Linton Frazier, she's a Pop Pilates instructor, and she's going to teach Pop Pilates tonight and talk about heart health.
Yeah, and that's going to be at the PNC room at the KCAC.
Yes, that's
Yeah.
tonight. And then tomorrow is actually Wear Red Day. Wear Red Day is national, and that is to raise awareness for women's cardiovascular disease, as cardiovascular disease is the number one killer of women. So wear your red tomorrow. We do that at IRMC, and it's very fun to see everyone wearing their red to raise awareness.
Now, when we began talking with you this morning, Sarah, we were talking about the connection between heart and stroke. And there is a specific stroke awareness month. We'll get to that in a couple of months.
Yes.
But we do want to make that connection here this morning as well. The heart has a very, very intimate connection with the idea of stroke. And talk about that, develop that for us a little bit.
Yes, so a lot of the going back is that a lot of it, the predisposing factors of both are the same. So high blood pressure, you want to control that. High cholesterol, those, and an unhealthy diet, those all put you at higher risk of obviously having stroke and a heart attack. But the biggest takeaway is that the vasculature that goes to your heart also, goes to your brain, and a lot of those problems coincide with each other.
Yeah. Absolutely. All right. So we've got what happens before the heart attack, what happens with the heart attack, the post heart attack routine that we go through, the cardiac rehab. That's a very, very good unit, isn't it?
Yes, cardiac rehab is amazing. We do have a 3-day program there. It is growing even more so, I think, this year. But we have a very good turnout, and we have some great nurses and electro up there.
Yeah, yeah. So it's a really complete team approach from IRMC when it comes to heart health, and we appreciate so much that so many people dedicate themselves to that. In terms of building that heart muscle back up and making sure that the pipes are clear, if you will, those are things that require some lifestyle changes for some folks that might be a little bit difficult.
Yes.
But you've got the support that is going to help them to get through whatever it is. There connections between what you're eating, your diet, your exercise routine, smoking, all of those different things. They all relate to heart health. And if somebody is having difficulty breaking some of those poor lifestyle habits, you can help them do that too.
Yes, we can. And each patient who also goes to the rehab, they obviously get an individualized plan of care. And also, if you don't go to rehab and you may have had a heart attack, we'll give you that individual care on your discharge planning and set you up with the resources that you need.
Feeling the chest pains, don't wait. Get
Correct.
in there. Need to get in there, need to get it checked out. And then regular visits with your cardiologist will help you to maintain your heart health. Sara George, thank you so much.
Thank you, Todd.
We're glad you came in to visit with us today on this day of all days with all of that stuff that's happening out there along the roadways. We appreciate you. Thank you. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. At 24 minutes after 8 o'clock, good morning to you. Glad that you're with us here today. So the weather is a concern for us. We want to activate the Storm Center for you once more.
Storm Center.
Storm Center this morning brought to you by Accent Fuels of Homer City. And here's the latest that we have for you today. S&T